Welcome everyone to today's Google Hangout, sponsored by the Blogalicious community. We're here today at the studio of the Department of Health and Human Services with Secretary Sylvia Mathews Burwell, and we're really excited to be here today on behalf of Blogalicious. I am Meredith Hurston.
Meredith, welcome and glad you're here today, and so glad to have you and the Blogalicious folks who are joining us here today.
Yes, thank you. So as you know, Blogalicious is a multicultural blogging community and digital media content creators, and many of us kind of blog on the side a little bit or create content on the side, but some of us are full-time self-employed, so it's really important to understand how the Affordable Care Act is going to impact us in terms of like having healthcare insurance. And Blogalicious is a multicultural community predominantly made up of African Americans, some Latino, some Asian. So we're really interested to hear how the Affordable Care Act is impacting African Americans. And we put out a call to the community, the Blogalicious community, as well as some of the communities that I am a part of on Facebook, and everyone responded mightily with questions. So we have some questions for you today, and I'm just excited to have this opportunity to hear from your lips to our ears exactly the answers to some common questions that people want to know.
Great, I'm looking forward to it.
Okay, so let's jump right into this deadline. This deadline is looming and approaching. When exactly is the deadline?
The deadline is February 15th, so folks have through next Sunday to sign up, and that's our open enrollment deadline. And what that means is that this is the period when people can come in, shop, and enroll for coverage in the marketplace. And so we're encouraging everyone, and I would encourage folks not to wait till the last minute, as some might do, but we want everybody to come in and see, shop, and find affordable healthcare coverage. What we know is that 8 out of 10 folks who were in the marketplace last year can come into the marketplace and find coverage for $100 or less a month. And that's about the cost of your cell phone bill. So affordable quality coverage by the 15th. And we want to encourage everybody to come in and do that before the deadline.
Okay. And so they need to get their application started either on healthcare.gov, or they can call a 1-800 number or go in locally to get that process started.
That's right. And so one of the things we focused on is making sure that the experience meets the consumer where they are. And part of that was making sure we have a website that's working, and we worked hard to do that this year. But customers can do it 3 different ways because different customers want different types of things. First, for someone who wants in-person assistance, you can go to localhelp.healthcare.gov, put in your zip code, and find out where you can find somebody who will meet with you face-to-face to help you. If you want to just talk to somebody on the phone and walk through it that way, 1-800-318-2596, and that's either in Spanish or in English, whichever you'd like.
Can you repeat that number one more time?
Yes, 1-800-318-2596.
Okay.
And the third way is for those who just want to go on to either healthcare.gov or cuidadodesalud.gov. Go on, do it yourself in terms of our website. So either of those 3 ways, go on, get started, and as long as you're started by the end of the 15th, you'll be okay.
And I have the fortune of being insured through my health employer, or I'm sorry, not my health employer, but through my employer. And I actually went on healthcare.gov just to see what the experience was like. And I really appreciated the fact that you could compare the coverages. You could limit it by deductibles or by premium. They had a glossary of terms in case anything was confusing, because I think sometimes it can get a little bit confusing about co-payments and co-insurance and things like that. But I think that it was rather intuitive and laid out very clearly if you go to healthcare.gov and get started. So I think that's great.
So we tried to create more tools. This year, our window shopping tool, we put up a week before everything so people could go, and there you can list the plans by premium, or you can flip it and list them by deductible. We've also included videos and other learning tools because for sometimes, for folks, this may be the first time. They haven't had health insurance this way, and they need a little help with terms and that sort of thing. So we're trying to provide tools that you can use on your own, but if you also need help either through phone or in person.
Great. And what is needed to enroll? So if someone gets ready to sit down at their computer and go to healthcare.gov, what do they need to have with them?
So they need their social security number or whatever their identification number is if they are a legal resident of the U.S. So something about that. The second thing they need is information about their employer in terms of your income and your income level, like your W-2, that can show your income level, because that will help determine how much you can get in terms of subsidies or help. The other thing you'll need is information if you are currently enrolled in a health plan, or if your employer has a health plan. You need to have that information, because you need to know that in terms of what other health care you have access to. And so that's for you and your family, need that information.
Okay. So who is eligible to enroll for coverage?
So in terms of the marketplace, as long as you're a citizen of the U.S., a legal permanent resident, you can enroll. The only categories you can if you're incarcerated or if you're already on Medicare. So there are very few categories that you can't go to the marketplace and enroll. It's different in terms of who's eligible for subsidies.
Okay. So can you have marketplace coverage instead of coverage through your employer?
You can in certain cases, and what it's dependent on, you can come on the marketplace at any point in your time and do it, but the subsidy is the issue in terms of if you want that financial assistance. The way that financial assistance occurs is if your current employer doesn't provide coverage that covers approximately 60% of the average total costs of your health care in a year, and if it is greater than 9.56% of your income. So it's about the quality of the package and the affordability for you as an individual. If those two things aren't met, then you can apply for subsidies as part of the marketplace. But even if they are met, you can still go in the marketplace and shop and get coverage.
Okay, so there's some specific criteria for that. So is there a sliding scale payment? I think that affordability is a concern for some people. And one of the questions that we had from the community is there a sliding scale for payment? And are there different plans to choose from?
So there are different plans to choose from. And as you think about those plans, it's bronze, silver, gold, they're done that way. And that's about what percentage will be paid in terms of your total cost. And I think as people think about cost of healthcare, it's important to think about the premium, the deductible, the question of copays or co-insurance. And copays is a set amount that you pay each time. Co-insurance, when you reach a certain level, is what percentage of the bill that you would be responsible for. And so that varies by plan, and you can shop by different plans and shop by different levels to find out what's best for you based on your needs. So you may have some expensive medications that may drive you to certain types of plans. And so the idea is to create an experience where you can shop and meet the needs that are best for you, meet the plan that meets your needs best, both in terms of the benefit package you need as well as the cost, whether for you a premium's more important or a deductible is more important.
So in terms of the coverage, it sounds like we addressed the copays, but one of the questions we had is, are copays required for clinic or office visits and prescriptions? Is there pre-approval required prior to treatment as well?
So different plans, but with regard to a lot of the copays, one of the things that's very important about the Affordable Care Act, and this is both for marketplace plans, the plans that you can shop for on the marketplace, as well as for people who had employer-based coverage like we do, there were certain things that the Affordable Care Act said will happen without any additional payment. And those are things like immunizations, flu shots, measles shots, and things like that you won't have to do copays for. There are things like preventative care that's important, like a wellness exam. When you take your child in for that annual wellness exam right after their birthday, those things there aren't copays for. And the other thing that's really important, and it's particularly important to the community that we're speaking to today, is that there are certain preventative care like cancer screenings that can occur without additional payment. And that's both for the plans that are in the marketplace, but also outside the marketplace. And so those are millions of people outside the marketplace that are getting those benefits as well.
And so those are required for all coverages now, even employer-based.
Yes.
That's one of the things that was written into the Affordable Care Act.
That's correct.
That's awesome.
So those are some of the benefits. I think many people focus on that very important benefit of affordable coverage for those who couldn't afford it and were uninsured or didn't have affordable coverage. But then there's a whole suite of benefits that occurred for people who already had insurance. And that would be those kinds of preventative services and things without copays. It's also, you can keep your child on to 26. It's also no pre-existing conditions and no annual caps or lifetime caps. And those annual caps, I spoke to someone on the road and she didn't get it. She delayed chemotherapy treatment until a year rolled over because she had an annual cap before the Affordable Care Act. So those are all things that are important in the employer-based coverage as well.
That's great. And we actually have a success story that we want to share with Miss Yvonne. She was able to get signed up for coverage through healthcare.gov. So we have a video just outlining her experience because I think it's important to share the case studies of successful outcomes.
Speaks louder than any numbers.
It does.
We are on the corner of 20th and Locust in downtown Philadelphia, and I was standing here on the street corner last year, just waiting for the light to change. And my left leg just swelled up to twice its size, and I just collapsed hard right here on the corner. It turned out that I had a deep vein thrombosis, which was caused by a giant fibroid. I did not have health insurance. I was trying to, with the guidance of the hospital, trying to see if I could get Medicaid. When that didn't work out, it was suggested that I try the marketplace. I went to the healthcare marketplace, and fortunately I was able to sign up pretty easily. I got a plan I could afford. That's about $120 a month. And not only did it enable me to just go to the doctor, it wound up paying for surgery that saved my life.
That's a powerful story, and it really resonates with me because I actually had fibroid surgery a couple of years ago, and thank goodness that it was covered through my employer-based plan. But had she not been able to get insurance through the Affordable Care Act, that could have had some other consequences. So that's a powerful story.
It is a powerful story, and one that I've heard throughout the country. And whether it's a young woman in her 20s who very healthy, worked out every day. Her mother talked her into going into the marketplace and getting coverage, and then she ended up with stomach cancer. And so just story after story, or the young gentleman who actually enrolled his family the opposite way. He's 23. His family has a small business. They've never had coverage. He enrolled them all, and then he had appendicitis in the spring of last year, and that was covered. And so, you know, there are those stories, and there are the preventative stories too. I've met the folks who, because of what's happening in the Affordable Care Act, went and had that mammogram and discovered that breast cancer, or went and had the colonoscopy and sadly discovered colon cancer, but fortunately met those folks and they're doing well now.
That's great. That's awesome to hear that, the good report. And I know that the law focuses on prevention, and you've mentioned some of the services that are offered. Can we talk specifically about some of the services that are offered for women?
Yes, things like mammograms and well women's screenings are some of the very important things, as well as issues of contraception. So those are the kinds of things that women are able to access. And the other thing that's important that was part of the Affordable Care Act is you can no longer be discriminated in terms of pricing because you are a woman. And previously that could occur because women have different needs, but that no longer can occur. So it's preventative services that are extremely important to healthy women. And the other thing is, within the marketplace, if you go into the marketplace, there's something called 10 essential health benefits that every plan in the marketplace must have. And you know, one of the important ones there is prenatal care.
Awesome. What kind of mental health services are now covered under the Affordable Care Act insurance plans?
So that's another important part of essential health benefits. And it's one of the biggest steps we've taken as a nation in terms of it is required in those plans to have behavioral and mental health as well as substance issues coverage, so that we can work on those issues as a nation, and people coming in can get that coverage and work on those very important issues.
So do you think that this provision in the Affordable Care Act will help with some of the disparities that and the barriers that minorities have in terms of receiving mental health care?
Yes, I think that in terms of the disparities in that space, yes, it will help there, because we know that a disproportionate number of whether it's African Americans or Latinos are the uninsured. So as they're coming through and getting these plans, they'll have that coverage. I think the other thing is, because there is a disproportionate number, the overall marketplace will bring people in to get that coverage. And the other thing is, many of the preventative services and the wellness services are things that can prevent a number of the conditions that are disproportionate disproportionate to those populations. So using that care once people get it to make sure that they're preventing some of the things that disproportionately populations have. So doing the wellness visits to make sure you get ahead of that diabetes or you get ahead of that heart disease.
Indeed. So I guess our community predominantly would be categorized as millennials, but we also have some other generations like the sandwich generation. We have people that are working that have elderly parents that might have small children. And in terms of looking after our parents, for those that are approaching retirement, we tend to ask questions to kind of make sure that we're helping them get situated as they apply for coverage, for health insurance coverage. If they're not quite eligible for Medicare, are they eligible to apply in the marketplace?
They most likely are. They certainly can apply. And the question is will they be eligible for subsidies? And anyone can, any of those folks who are deciding that they may want to stop right now in terms of their employment right now, they can go into the marketplace and find out if that's the most affordable way that they can get coverage. Encourage them to do it before February 15th. Although one of the things that you can do is if you have a change, if you move out of a city, if you move out of an area, a coverage area, state to state, or if you have a life change, you still can come in. There's something called a special enrollment period if you have a child, if you get married.
Okay.
But would encourage everybody who's in that situation you just said to come in before February 15th.
And browse around the marketplace to see, because COBRA insurance can be very expensive. So the healthcare.gov, the marketplace might be an excellent resource to look to see if you can get the same level of coverage at a less expensive cost.
And the other thing that's so important for a person in that situation is, they may have a pre-existing condition. Many Americans actually do, and especially when you get to that age. And so that's something that the Affordable Care Act changed, that you no longer need to worry about that. That's not something that'll be part of your decision making, because you can't not be covered because of a pre-existing condition.
So let's talk a little bit about policy. We know that the law is a federal mandate, but it's being implemented at the state level. And so I think people, when they talk to their friends or family in other states, they become aware that the law varies from state to state. Can you talk a little bit about why that is?
So there are really two different elements in terms of that. There's the issue that insurance is regulated at the state level. So there are certain elements that happen at the state level in terms of things like premium reviews occur with state insurance commissioners. We here at HHS give guidance and rules about that. It actually occurs at the state level. And so that's a place where things are unique at the state level. But the other thing that some people are questioning and wondering a lot about is Medicaid expansion.
Yes.
And the question of what happens in different states where there isn't Medicaid expansion. And we know that in a number of states that there are a disproportionate, again, number of the communities that we're talking about today, both in terms of African Americans as well as Latinos, in the states where Medicaid expansion hasn't occurred. And what we're doing, and what I personally am doing, is one of the first things I did when I became secretary is meet with the National Governors Association to tell all those governors, want to work with them on a plan that works for their state. I know different states have different needs, and what we want to do is just make sure that as part of the expansion, there is a basic insurance coverage that meets the law in terms of what we believe is coverage, good coverage for people. But beyond that, we're willing to have conversations about how we can be flexible to do plans that will work state by state. Recently, Governor Pence of Indiana announced that an expansion has occurred there in Indiana, and he and his team in Indiana are already implementing it. Just as we announced it, they were in place to implement.
That's good news. That is great news. Is there any possibility that this law could be repealed and that healthcare coverage could be taken away for those that have enrolled under the Affordable Care Act?
So I think this is a place where the president's been clear and been clear about a couple things. I think it's important that the president's been clear that something that repeals the Affordable Care Act is something that he will veto. He's also been clear, if there are things we can do to improve it, and people have proposals to improve it, that we want to have those conversations. We want to make this better. And how will we judge it? Those kinds of things that aren't about repeal, but are about possibly making it better. We're going to look at a couple things. We're going to look at affordability, quality, access, and how it affects the economy, especially working families. And so we want to see those things, and that's how we'll judge them. Recently, there was legislation that had to do with a change that has to do with how veterans are counted against a business's numbers in healthcare. we are supporting that change. There's another bill that's been talked about that would make into law something we've done by regulation around firemen, volunteer firemen. And so we support those provisions. So with regard to repeal, though, been clear, that's something the president will veto.
So we can all breathe a sigh of relief. What if you missed the deadline? You spoke a little bit about special circumstances. Let's go a little bit more into depth. If you missed the deadline, when is the next opportunity to enroll?
It will be next fall.
Okay.
So that is the time when we will start an open enrollment again for all but a few, small group of the population who have life changes, as I mentioned. If you have a baby, if you get married, or if you move from state to state, or if your job situation changes.
Okay, so if you decide to forego coverage, what type of penalty or fee is associated with that decision?
In 2015, that fee will be 2% of your taxable income, or $325, whichever is greater. And it's most likely it'll be the taxable income amount.
Okay, is that per person or per household?
That is per person, and it will be more per household.
Okay. Is there any special circumstance, like in terms of affordability, where that fee could be waived?
Yes, so there are exemptions, and for those who can't afford coverage, they will be exempt. And we measure that by if you couldn't find coverage for 8% of your income. There are also exemptions for other things if you've had a life circumstance. So for instance, if you've been impacted by a natural disaster in the past year, that's something that would lead to an exemption. So anyone who can afford, they are exempt. And then there are a couple other exemptions that occur for people. And you can find those on healthcare.gov.
Okay.
And find out exactly what those are.
So I think that the position, is quite clear that we want, Americans to get covered through this mandate. But if you have a special circumstance, don't fear that
That's
you
right.
may be eligible for
an exemption.
Yes.
And the idea, the basic premise is the idea that in order for us to have a system that covers people with pre-existing conditions, that we should all play. And so that we don't have people who just decide not to get coverage, who can afford that coverage, and then when they have something go wrong, can't pay for that coverage. And then those costs are spread to all the rest of us.
Right. And it's an increase in premiums across the board.
That's how it will get expressed. And so the idea is that if you're not making sure you're covered, that there will be some fee as part of getting everybody as part of a system that works.
Okay, so let's go back to that deadline again. When is the deadline?
The deadline is February 15th, and 3 different ways. 1-800-318-2596 if you want to call and you can talk to somebody live in either English or Spanish. Go to localhelp.healthcare.gov and you'll find out where you can find in-person assistance, or go to healthcare.gov or cuidadodesalud.gov. Any of those options, because we want to meet the consumer where they are. Different consumers have different approaches. We've tried to make it easier for 70% of folks coming in. The application went from 76 screens down to 16. And for those people who are coming in to re-enroll, we have it 90% pre-populated. So we're trying to do everything we can to make that consumer experience more easier, intuitive, simpler.
Great. I really appreciate your time today. Those are all the questions that I have for you. But as we close out the program, I would like to thank Secretary Burwell for her time today. This has been an awesome opportunity to get direct answers from her. And on behalf of Blogalicious, I appreciate your time. Again, I am Meredith Hurston, and thank you for joining in and listening today and watching today.